to answer. At least we will try to answer. Let's start it. Okay. Yeah. Good morning, everyone. Thanks for attending our session. And we are going to present our qualitative study on supporting families experiencing domestic violence and abuse during COVID-19. And it is actually a practitioner's perspective of impact on their services. So as a presenter, I am Dr. Mahuya Kanjilal. I'm a lecturer from Institute of Society and Community. And with me, I have my colleague Susie Hawkes, who is senior lecturer from the same department. Next slide, please, Susie. Okay, just to give you a very brief background, with this research, we aimed to understand how COVID-19 actually has impacted the services, especially those services who support families where domestic violence and abuse occurs, and they work with those service users. And we decided to do few case studies. And today we are going to talk about our first study, which we did with Living Without Abuse, which is a leading organization of England who works with service users of domestic violence and abuse. And we also tried to identify some areas of innovation, some positive changes happened during this time. And from that, actually, in future, how practice can learn from that, and practices, how they can be modified, and what we have learned from this analysis and from this research. And we planned to do more case studies in future, very soon, actually, with local authorities. Next slide, please, Susie. So the study is a qualitative study, as I said, and research methods include one-to-one interviews with 15 semi-structured questions. We also had 9 demographic questions to record their demographic information. And because of COVID restriction, we couldn't do our interviews face-to-face. So we did online one-to-one interviews. And we used MS Team platform, and all the interviews were recorded. And then we transcribed, actually not, we don't did the transcription because of MS Teams. We got the transcription, but then we needed to sort of clear the transcription to make it readable and made for analysis. So we then coded the transcribed, and then themes were emerged from that analysis. And today we are actually sharing our very early findings from first round of interviews, and 21 participants from the organization actually participated in this study. Again, just to give you very brief sort of a characteristics of our participants. Here are some charts which shows work experience and job roles. And you can see that work experience wise, our participants are quite experienced in their role, and majority, actually more than half, have they are in their role for over 6 years. And you can see the purple color, that's showing the participants who have in the role for more than 15 years. So they are quite experienced. And the blue color shows the participants have experienced less than 3 years because of the job demanded more people. And that's why they were recruited during the COVID. And that shows the new recruitment in blue color. And job role wise, majority of our participants are from, they are victim support worker, but we also interviewed people, participants from senior management level to understand their perspective as well, and how change is actually impacting from their level. And this slide is about demographic information of our participants, and ethnic distribution shows that majority of our participants came from white British background, and the next portion came from British Asian background. And age range wise, I think 57% of our participants are aged between 30 and 50. Only 3 are below 30, and 2 are actually above 60. So again, age range wise, it's quite diverse age range we got from our participants. And these are the primary themes we identified from our analysis. So you can see we tried, as I said before, we wanted to understand the changes in practice happened during this time, during COVID time, and because of lockdown and because of the restrictions. So we identified some negative impact, which was expected to find some negative impact, but we also find some of the positive impacts, which are really encouraging. And then the next themes, we found that changes in referral, there were huge changes in referral, and that also referral changes differently in different time. And Susie will talk more about those themes in a few minutes. And then the fourth theme, we identified how that impacted on service users, even though we interviewed all the practitioners. Still from that interview, it was quite clear that the service user they were impacted. And again, we found some of the impact are quite negative and some are quite positive. So it was really good to understand how this theme emerged. And then multi-agency working certainly got better, and that's one of our main theme, primary theme we identified. And the last but not least is innovation, because we were quite interested to find any innovative ideas that occurred due to the changes in practice. So next slide, over to you, Susie.
Right, so thank you. So I'm going to talk through some of the sort of details of the changes and information that we found. So in terms of the sort of positive changes to practice, the staff, the workers talked about issues such as a better ability to manage overall, a better ability to manage their time, and a better work-life balance. Some of this was linked to the fact that they were covering a large county council area, and this meant that sometimes, in order to undertake one visit, they may have to travel an hour there and an hour back and have the visit. So online working really did reduce quite a lot of travel time. So when they were talking about time management and sort of flexibility, that often they were talking about that in terms of sort of undertaking their work in this large geographical area. Some staff in terms of did mention, which I think is fair to say, that in terms of work-life balance, although most people felt that it was generally a better work-life balance, with one worker saying that what is in the quote there, that they felt that it was a better work-life balance working from home. They were able to start a little bit earlier and then nip out for a walk if they were stressed, and sort of that helped them in terms of managing the workload. If they'd had a difficult interaction, they could sort of take a break after it. But some people did find, and a couple of people did mention, that they ended up working beyond their time. They also found that there were they developed creative ways of engaging children. They had been developing a tool for working with children with Nottingham Trent University. And this, because of COVID, was turned into an online tool. And I think that helped them. I mean, that was one of the ways in which one of the tools that they developed. But from that, actually, some of the workers talked about creating things like PowerPoints to engage children online. And they would theme those PowerPoints with football teams or cartoons that the children liked in order to engage them. So it's about using tools like PowerPoint in a creative way to engage children online. And this broadened their sort of thinking around how they could engage with children. And finally, they identified some gaps in service. Some of these things will be talked about by Mahuya towards the end, about innovation in practice, but they did create sort of new sort of ways of working with service users. They created new services, and I mean the tool around the online tool about engaging with children, which was developed from something that was in the process of being developed but was adapted as a result of COVID, again was just another example of how they had created additional sort of services, and that says we created trending, it should say befriending services. They started in May last year, and so they sort of created this befriending service that allowed them to support people emotionally, and that was something that they hadn't had so much ability to do previously in one-to-one work. That had been often done in group work before COVID. So in terms of more negative changes in practice, what they found is, I suppose unsurprisingly, they were working in domestic abuse. They were working with people who were often quite traumatized and had experienced traumatic incidents. And so for some people, doing the job was quite difficult over the phone. Initially, a lot of them found that they ended up having to do things over the phone despite having technology, that actually over the phone was the only way to do it. And I think that was that was particularly the case for certain types of job. So there are different, living without abuse is an organisation, there are different people doing different types of jobs. Some people work right at the beginning with referral and people in crisis, whereas other workers are working with people who are more stable, but are sort of helping them to re-establish themselves or working them through more settled problems. Those who were working in crisis did find that working with people and talking with people face to face, talking with people over the phone about risk and things was really quite difficult. Following on from that and sort of really underpinning that some of the reasons why they had problems was that actually not all service users had the same level of confidence in using technology. Some service users didn't have the technology, but quite often they struggled with things, quite simple things like downloading and understanding how to use the technology, or they may only have a mobile phone, not a computer, so these things weren't quite so easy to use. The other thing which was interesting that I think came out was that actually, as is detailed in the quote, actually sometimes a lot of the service users weren't that confident in seeing themselves online. So actually the seeing themselves on the computer and looking at themselves, having themselves reflecting back, was quite a difficult thing for them. So that put them off engaging online. And many workers talked about the difficulties of building up rapport with service users. Obviously, again, working with people who are at difficult stages in their lives, who may be currently experiencing domestic abuse or may have just left a domestic abusive relationship. They actually found that it was quite difficult sometimes to get the rapport with service users to enable them to work as effectively as they had done in the past. And one worker talked about a young mum she'd been working with and had struggled to engage. She'd not engaged very much. Over Christmas, she went and dropped off some presents. She actually didn't speak to the woman herself, but she felt that afterwards she noticed a large sort of change in the way the woman engaged with her. And it sort of, for her, it really symbolised how important the face-to-face work was in building up rapport. And again, just flowing from that, what people found was around natural conversation, that it was very difficult to have natural conversation with people, even for those on those occasions when they could meet face-to-face. When they could get together face to face, they were socially distanced and they were in parks, in public and things like that. So it was quite difficult to build up relationships with people. That was quite difficult for them. So changes in referrals. What we found was that it was a complex picture, the changes in referrals. There were lots of actual contradictions in some ways. So there was a large increase in referrals, but actually there were certain aspects of referrals that reduced as well. So there were, and the referrals didn't all come immediately after lockdown. So the referral rate reflected lockdown. So when lockdown first happened, there was a large drop in referrals. And workers generally attributed that to people actually being unable to access referral routes. So quite often women who were being abused couldn't actually, because of lockdown, it meant that their partners were at home, that they had very little opportunity to leave the house. So actually contacting agencies was quite difficult for them. But they were also not taking their children to school, so they couldn't contact teachers, and teachers weren't seeing children, so they weren't making the referrals as well. The other thing that was interesting that was highlighted is the women weren't having contact with other people, other women. They weren't talking to friends and relatives, and therefore people weren't pointing out to them the problems in their relationships, in these conversations. So there was a whole range of reasons why workers felt that when lockdown first happened, there was a change in referrals. But as the first lockdown, we emerged from the first lockdown, they saw a large increase in referrals. And this was generally put down to people having, let's say, held on to these things. And then when they got the opportunity, they did make these referrals. There was variability across services. So in some services, such as the young people's domestic violence workers, for young people, young people sort of teenagers, there was a dramatic drop-off in referrals, and that remained throughout. Whereas in the family support service and the crisis service and the children's service, there were overall large increases in referrals. And just finally, there were some increases, there were some changes around the nature and type of referral. So there was an increase in referrals around domestic abuse from children to their parents. And actually the people who, there was another thing where there was an increase in frequency and severity for women who had already were in domestic violence relationships. So there wasn't so much a pattern of increase across the board in domestic violence, but for those women already experiencing domestic violence, there was a significant increase in in their frequency and severity. I mean, in terms of impact on service users, COVID restrictions constrained their relationships. These are things perhaps we've already touched on, constrained their relationships with support networks such as family and friends. It restricted them with perpetrators. So perpetrators were furloughed. Perpetrators who previously would have gone out to work were now furloughed at home. And that perhaps explains the increase in frequency and severity. They did find it a lot more convenient to attend groups online, and that was one of the big wins for service users. But finally, there was also a big increase in mental health that perhaps has been reflected quite broadly in the press around that, and I think that's something that we found similarly. So multi-agency working, sorry, I was not expecting this, to share that what they found is that sharing resources and ways of working with other services, that had been a huge bonus, that they had some difficulties around navigating multi-agency working, around particularly working in the virtual world. So for example, schools were anxious about children being online alone with workers. And the restructuring of services had made it quite difficult for some workers to to access services because they were not sure of how to now access services that they previously had known. And there were also benefits in terms of team meetings. Firstly, that this was a service that team was stretched over 2 offices. Team meetings, people became more familiar with each people working in the other offices, but they were also more easily able to invite external organisations and speakers into their team meetings, which again increased multi-agency working. Mahuya.
Thanks, Susie. Talk it very briefly. So innovation in practice, as I said before, that one of our aim was to find any best practices happening during this time. And these are some of the innovations that we found out from our analysis. First one is online evening sessions. So there was no such service before, but because of the online sessions, people couldn't do during daytime, and online evening sessions, when they first introduced, there was some people were not very happy, some service users, but they certainly realized it's easy to do online evening sessions, and even they stop at 8, they can immediately go to their other stuff in house. So its online evening sessions became very popular, and Living Without Abuse, they decided to carry it on even the restriction is over after COVID and we go back to normal. And befriending service, as Susie touched before, this is a brand new service, and this also emerged from necessity because they had quite a number of volunteers, and they couldn't do anything to do with volunteers, and there was a gap in services of emotional support to service users. And now they started this befriending service where volunteers are actually calling service users and supporting them with over phone. And then creation of online resources of group activities. They have got now quite good resources to do online activities, and they worked with Nottingham Trent University to create all those resources. And those first three sort of practices are for service user, but last one is creation of buddy system. It is actually for practitioners, for staff, because this work is quite heavy, emotionally heavy and quite stressful, and they were not able to share it with any of their colleagues. They are not going to office and they are not talking in a office space, and that's why again it was a necessity came out from this time that they started this buddy system to support each other, to support emotionally each other. And they've also had some other introduced some other extra training for self-care for staff, extra support for taking break, and they also helped with flexible hours for homeschooling for staff. But I think buddy system is one of the best we realized that happened during this time. So with this presentation, we tried to show you the impact on services and impact on service users from practitioners' perspective, and we also tried to find out some innovative changes and best practices. So thank you for attending. We don't have enough time, but here are our email address. So if you have any question, please feel free to ask any of us or both of us. We will be happy to answer that. Thank you so much.
Let me end the recording.